Physiotherapy and mobilization are therapeutic techniques used to restore and improve movement, function, and overall well-being in individuals with injuries, disabilities, or movement impairments. Here's a general overview of how physiotherapy and mobilization are performed. 1. Initial assessment. Before starting any treatment, a thorough assessment is conducted by a qualified physiotherapist. This assessment may include reviewing medical history, performing physical examinations, assessing movement patterns, and identifying areas of concern or dysfunction. 2. Treatment planning. Based on the assessment findings, the physiotherapist develops an individualized treatment plan tailored to the patient's needs, goals, and condition. Treatment goals may include pain relief, improving range of motion, increasing strength and flexibility, enhancing functional abilities, and preventing further injury. 3. Education. Physiotherapists educate patients about their condition, treatment options, and self-management strategies. This may include teaching proper body mechanics, ergonomics, posture, and techniques for pain management and injury prevention. 4. Manual therapy techniques. Mobilization. Mobilization involves the passive movement of joints and soft tissues by a physiotherapist to restore or improve joint mobility, reduce stiffness, and relieve pain. This may include gentle oscillatory movements, sustained stretches, and joint gliding techniques. Manipulation. Manipulation involves high velocity, low amplitude thrusts applied to specific joints to restore normal joint mechanics, reduce joint restrictions, and alleviate pain. Manipulation should only be performed by trained and experienced physiotherapists. 5. Exercise prescription. Physiotherapists prescribe therapeutic exercises tailored to the patient's condition and goals. These exercises may include stretching, strengthening, stabilization, balance, and proprioception exercises. Exercise programs are gradually progressed over time to challenge and improve strength, flexibility, endurance, and functional capacity. 6. Modalities. Physiotherapists may use adjunctive modalities such as heat therapy, cold therapy, ultrasound, electrical stimulation, and traction to complement manual therapy and exercise interventions. These modalities can help reduce pain, inflammation, muscle spasms, and promote tissue healing and recovery. 7. Functional rehabilitation. Physiotherapists incorporate functional rehabilitation activities and tasks relevant to the patient's daily activities, work requirements, and recreational pursuits. Functional exercises and activities aim to improve coordination, balance, proprioception, and movement patterns necessary for performing functional tasks safely and efficiently. 8. Progress monitoring and reassessment. Throughout the treatment process, the physiotherapist regularly monitors the patient's progress, adjusts the treatment plan as needed, and reassesses functional outcomes and goals. Reassessment helps track improvements, identify barriers to progress, and modify treatment strategies to optimize outcomes. Thank you for watching. Don't forget to stay informed.